Alright, let's discuss the complex and integrated changes that occur with chronic aerobic exercise training. Understanding these adaptations is essential for coaches, athletes, and health professionals as it gives us insight into how to assess and enhance endurance performance while also protecting the body from the stresses of prolonged training. We'll go system by system to see how each adapts to regular aerobic exercise over time. Starting with the cardiovascular system, one of the most noticeable changes with aerobic training is an increase in maximal cardiac output. This is the total volume of blood the heart pumps per minute at peak exercise. This increase is primarily due to an enhanced stroke volume, which is the amount of blood ejected by the heart per beat. Over time, aerobic exercise makes the heart more efficient. Specifically, the heart's left ventricle undergoes structural changes. It enlarges with both the chamber volume and wall thickness increasing. This allows the heart to pump a greater volume of blood per contraction even at rest. Because the heart pumps more blood per beat after training, the resting heart rate naturally decreases as fewer beats are needed to maintain the same cardiac output. Highly conditioned endurance athletes often have resting heart rates as low as 40 to 60 beats per minute, compared to a typical 60 to 80 beats per minute in untrained individuals. This phenomenon is partially due to increased parasympathetic tone, a calming influence on the heart's pacemaker, the sinoatrial node. Another significant cardiovascular change is that during submaximal exercise, a trained heart rate response is lower for a given workload, and the heart rate increases more gradually, demonstrating the efficiency gains of endurance training. Additionally, aerobic exercise enhances the capillary network within muscles. With training, capillary density in the muscle fibers increases significantly, which improves the delivery of oxygen and nutrients to active muscles and facilitates the removal of carbon dioxide and other byproducts of metabolism. Capillary density is especially important because it reduces the diffusion distance for oxygen and substrates, making it easier for muscles to get the resources they need during prolonged exercise. Now let's move to the respiratory adaptations. While breathing capacity itself usually isn't a limiting factor in aerobic performance, the body does undergo specific ventilatory adaptations with endurance training. Training increases the volume of air breathed in each breath, known as tidal volume, and the frequency of breathing during maximal exercise. At submaximal levels, however, trained individuals typically have lower breathing rates but larger breaths, which makes ventilation more energy efficient. Interestingly, ventilatory adaptations are highly specific to the muscles and activities involved in training. For instance, if someone primarily trains their lower body, improvements in ventilation may not fully carry over to upper body exercises. These adaptations appear to stem from local neural and chemical changes in the muscles specifically trained. Nervous system adaptations also play a significant role in the initial stages of endurance training. At the outset, the nervous system becomes more efficient at coordinating muscle activity, which delays fatigue in the muscles. As the training continues, the body learns to rotate neural activation among synergistic muscles, allowing them to share the workload more effectively. For example, during prolonged running, the nervous system may alternate which muscle fibers within a muscle are active, enabling each to rest in turn, which helps sustain the activity with less fatigue and energy expenditure. Muscular adaptations to aerobic training are also profound. One key adaptation is an increase in the aerobic capacity of trained muscles. This means that after training, muscles can perform a given intensity of exercise with less effort and can handle higher intensities than before. Part of this adaptation is glycogen sparing, where trained muscles use less glycogen during exercise and instead rely more on fat stores, which prolongs performance. Another result is an increased threshold for the onset of blood lactate accumulation, allowing athletes to exercise at higher intensities before lactate buildup impacts performance. In well-trained athletes, onset of blood lactate accumulation can occur at 80-90% of their maximal aerobic capacity, a significant improvement. We also see changes within the muscle fibers themselves. While type 1 or slow twitch fibers already have high endurance capabilities, endurance training can increase their aerobic capacity even further. Fast twitch fibers, especially type 2A, can also adapt to aerobic training by becoming more oxidative, although some decrease in their glycolytic enzyme concentration may occur. These changes make type 2A fibers more similar to type 1 fibers in their endurance characteristics. Aerobic training often leads to selective hypertrophy or enlargement of type 1 fibers, although this increase in cross-sectional area isn't as pronounced as in resistance-trained muscles. Overall, this muscle remodeling results in a greater proportion of fibers that are equipped for sustained activity. On a cellular level, two primary changes occur in muscle tissue: an increase in both the number and size of mitochondria and an increase in myoglobin content. Mitochondria are the cell's energy powerhouses where aerobic metabolism occurs to produce ATP. With more and larger mitochondria, muscles can produce more ATP aerobically, which is more efficient for endurance activities. Myoglobin, a protein that helps transport oxygen within muscle cells, also increases, further enhancing the muscle's capacity to use oxygen effectively. This is complemented by an increase in aerobic enzymes involved in glucose metabolism, as well as greater stores of glycogen and triglycerides, providing fuel for prolonged aerobic exercise. Moving to bone and connective tissue, regular weight-bearing aerobic activities, such as running, can stimulate bone growth and improve bone density. However, for bone to respond with new growth, the exercise must be intense enough to exceed the usual stresses placed on it during daily activities. Intensity and the cyclical strain are key. This effect on bones is enhanced if aerobic exercise includes rapid, high-impact movements that put additional stress on the skeletal system, while it becomes harder to continue overloading bone as cardiovascular conditioning improves. Techniques like high-intensity interval training can provide a bone-stimulating effect alongside the cardiovascular benefits. For connective tissues, including tendons, ligaments, and cartilage, the response to aerobic exercise is similar to that of muscles and bones. Tissues adapt and grow stronger with regular intense exercise, particularly from weight-bearing activities. Complete movement through a full range of motion during these activities is essential to maintain joint health. Now, studies in animals such as dogs have shown that even strenuous running, when performed within reason, can lead to positive cartilage adaptations without causing joint damage. However, extremely long sessions may reduce cartilage thickness over time, emphasizing the importance of balanced training. Lastly, endocrine adaptations are another key component of the body's response to aerobic exercise. During intense and prolonged exercise, hormone levels adjust to help the body meet energy demands. Hormones like testosterone, insulin-like growth factors, and growth hormones support muscle, bone, and connective tissue health and help maintain metabolism. With regular aerobic training, there's an increase in hormone circulation and a heightened responsiveness at the cellular level. Although trained athletes may have less pronounced hormonal spikes during submaximal activities, they exhibit more significant responses during maximal efforts, allowing them to handle sustained high-intensity exercise better. In summary, chronic aerobic training drives a range of adaptations across body systems. We see cardiovascular enhancements like increased stroke volume and capillary density, respiratory efficiency gains, neural improvements in muscle coordination, muscular and cellular adaptations that support sustained activity, stronger bones and connective tissues, and hormonal shifts that optimize energy and tissue maintenance. These changes collectively enable athletes to perform at higher intensities for longer durations and recover more effectively between sessions.